Any questions? Or yes?
When you're doing the estimate of the cost, for example, take an example of the elderly. We have a projections of the coverage progressive growth 11.8% out of 100. How do you project that? Based on the fact that, first of all, the estimate numbers of the people with disabilities also is an estimate.
Yeah.
Now, how do you do that assumption for the growth?
Due to the limited information we have, we assume that the population growth of people with disability is the same as population growth in general. There was no other assumptions at hand. We are waiting for the government to come up with better data on disability. But for now, certain groups are considered to grow unless there are, for instance, a big national disaster. Then, of course, you would have to assume different because the number of people with disability would have to increase more. But for now, it is assumed to grow with the population growth. Yes.
What do you mean when you say take-up rate?
Take-up rate is basically the increase of coverage you have over the time spread. Because, for instance, the government do not want to immediately cover 100% because that would be a shock to the fiscal space. So you would want to provide a reasonable increase of coverage from, let's say, 0 to 100%.
In countries like Thailand, where you already have an ID system which is really functioning, if you want to develop a universal scheme, the take-up rate will be much higher. It will not take you 8 to 10 years to expand coverage, for instance, for the child allowance to the children, but it will take you 2 or 3 years, okay? Because we already know all the children, you know, they are in the database, so it's quite easy. But in countries where these integrated database systems are not yet in place, it will take time as well. So there is the fiscal impact, yeah, it's better to do it progressively, but there is also operational aspects to it.
Thank you. Can I just ask about the poverty line? I think in Indonesia you have an established poverty line, right? Let's say in some of our countries we don't have an established poverty line and it comes under depends who's the person, different types of lines. What would you do under such a costing approach? Because I noticed under elderly and disabilities, already the poverty line is a bit different, including inflation by about a few 50,000 plus rupiahs or 75,000 rupiahs if my math is correct. So how do you gauge that? You know, in your two costings already. One is if there's no poverty line, then how do you do your estimation? And why then in this particular case, the poverty line for disabilities and for the elderly, it seems to be slightly different. The costing, your costing, and I'm trying to understand that. Is it to get the buy-in?
Actually, the poverty line used is the same.
Maybe not poverty line, I'm using it wrongly. The amount of benefit that you're asking for. And,
the amount, yeah.
And based
yeah.
on poverty line and
yeah.
inflation.
So we had the option, those are options. You have the poverty line, which is around 220. And this program happens to give 300,000, which is slightly higher. The idea behind the program that's already existing is that these vulnerable people require slightly more because they need assistance, because the people with severe disability cannot do daily activity on their own. They need assistance and probably some more medication, for instance. So that was decided slightly above the poverty line. So it was purely a decision made. Some of it is very political, I would say. And in case there is no poverty line, I think you can make a few scenarios. for instance, you can take the $2 a day poverty measurement, which is quite, it's not always accurate, but if that's the best you can have. Or you can also make your own assumption of the daily goods required for survival. This exercises have been done. So because poverty line in Indonesia, for instance, is basically a basket of food and non-food based on local prices and how much that is. So you can also do that and present it as your own poverty line if there's no better figures.
Can I add another example? In some countries, you may consider that really the poverty line is too low. So you can also use, for instance, the minimum wage as a reference. For instance, in Thailand, we have recommended to introduce a sickness benefit for people in the informal sector. So if they are hospitalized, they will get 2/3 of the minimum wage during a maximum of 20 days per year. Yeah?
I have two questions. The first one is, at the time when you are identifying which of the recommendations are costable or not costable, do you have any support document, like a kind of checklist or something like this to decide it, or is just your opinion about what is costable or not costable? And the other question is, at the time, who designed the scenarios? Is just one person, or if a group of people, or several stakeholders?
Okay, I'll answer the second question first. The process we have in Indonesia is involving many different agencies. We have a group within the UN, the UN PDF group, that has a subgroup for social protection, and that was quite convenient because then you have representatives of each agency in that group, and we just have a monthly meeting or when necessary weekly meeting. We introduce, some of them are quite familiar with it, WHO for instance, or UNICEF are quite familiar with the SPF, some of them are not, so we introduced the concept. We had meetings with them, and we discussed the whole process with them. And then we have, we form also a group, or more like consultations with all relevant government agencies. So we had workshops and consultations, one-on-one consultation and big workshops, discussing all the different parts of the assessment. So the stock taking, for instance, we get documents from them, we discuss with them, and we send them drafts, for instance. And when we do the costing also, recommendation and costing, this is through discussions. So, and to your first question, which is the costable scenarios, it's mostly it's a lot based on the discussions, and of course based on the available data. So we have to first see whether the data is available and whether it requires further actuarial calculation, which is beyond the RAP protocol, and whether the group thinks this is necessary to cost or realistic to cost. Yes.
First of all, thanks a lot for your presentation. I think it was very clear, like the main basic parameters, how to do the costing and everything. But I would like to go a step further. First, very often we do the costing, how much it costs. And now, if we understand your presentation, this is done on individual basis and basically done by age. Very often the next step in the assessment is to do the impact assessment of this benefits. What is this value for money a little bit? And my question is a little bit about the integration of the system. Let's assume we do the costing for the old age. And we also do the costing for the child benefits. At some point the money will actually go to the same household. So my question is, how do you actually move back from like individual payments and rebuild some kind of family household, and how much money they will actually receive out of like the whole, let's say, floor package? Technically it's a bit challenging because you need actually to recompose families and to make sure that the money you're investing as part of your social protection floor, and to be able to do an impact assessment, you need to know at the end of the day how much money is going to one individual household. So I would like to know if you have done some development, and technically, how do you deal with this issue?
Okay, thank you very much. That is a very interesting point, actually, something that we have not done. We have not got to the impact assessment part, although we have discussed several times, and it was very much encouraged by the different, especially the different UN agencies working for the different groups, because from this assessment, for instance, then you spread the different parts to UNICEF for children, for instance, WHO only for health, but we'd like to know also how it overall impacts the people, and we have not done so, but I think it's one step further that is necessary to do.
If you look at the presentation, you know, the 3 steps, I think this part is in the green step, the first step, yeah? It's beyond the costing, but we could do also many other studies, like the rate of return, or, you know, more complex models as well.
Yes, I think impact assessment is on one side, but I think my question was how much money is actually going to one household. I think we're still in the costing element of it. Because let's say you receive money from like the child benefits, and also you receive money from, let's say, the old age pension. As an household, you actually receive some money. My question is more, how do you actually put the figures together for one individual household, if it's done, or if it's if you have any indication how this can be done?
That has not been done. I think we can see further whether that can be done. I think the data would allow us to do so. At least if you want to see per household, yeah, not to the impact yet. But yeah, that has not been done. So maybe we have discussions after this.
But the purpose of such an exercise would be to see whether the household receives too much or not. Yeah. So maybe the final purpose is to maybe reduce the package so that it's not above a certain threshold, or what?
Is there a model somewhere that is working well on this? Because we have the same problem and we are very small. In Singapore, it's very easy, and we have ID card and we have everything, and we are highly computerized. And the single window service that we offer through what we call the family service centers, we still have duplication because we have multiple service providers. So I'm also thinking in terms of costing, is there, and we are also talking about this, that one household had a few doors and windows, to use the analogy of our colleague from Indonesia, can be opened. So that then it becomes a problem. Then the program sets under costing very low packages because they think somewhere else another one is coming and is coming, but it is not at all transformative. It is not part of the staircase approach, and then you find people falling through all over. So I would like to know, because this is exactly how, for example, the resistance, if I can call it, will come from the site that we are proposing. That how are you going to assure that there's no duplication? So I would love to know, is there a model anywhere that we can look up?
That's a good question. I think that's the big challenge, actually. I think while doing this whole exercise, I think we have an added value in the sense that we have a comprehensive view of who is covered and where the money is going. Very often we do this analysis by kind of age group, but to jump from this kind of individual assessment to the kind of household assessment, this is very challenging because households change all the time. This is composition of the household will actually evolve with time, so I would say the analysis is much more complex. Historically, I would say the IDA models were actually based on individuals, where it's much easier. You follow one person, you follow a cohort, and then you could do quite sophisticated assessment. But when we actually enter a little bit the field of poverty impact assessment, we cannot actually look at poverty only for individuals, because poverty is a lot related to your household, how much money you have as an household. So this is a little bit why I asked the question, to actually make this kind of bridge between the two. And this is still, I would say, the ILO, something that we are working on it. And we're trying to actually, whatever benefits is invested, we kind of recreate household to really trying to assess the impact assessment on poverty. So to directly answer your question, I would not say there's like already a prepared model where you could actually do this easily. And I think this is kind of models that is built on kind of country case. We'll actually take one specific question and develop a model for the specific needs. But I will not see any generic models in actually doing this, that we could share this model around the world and be convinced that's going to work for your own country, because it's very country specific, and this is very often based on technical cooperation project. But it's a very good question, and technically it's a good question. It's not like a straightforward answer to give you a proper answer.
I think there certainly are cases within social protection systems, you know, any kind of social welfare system where there can be duplication and you have lots of different benefits going to the same people, and it's all very unclear. On the other hand, when you look at the social protection floor kind of approach and model, my question would really be, is it duplication if there's a household that is both receiving, for example, an old age pension and an unemployment, some kind of unemployment support? You know, on one hand you could say, well, you know, that household's already receiving support and doesn't therefore need two grants. On the other hand, I think one way to look at this social protection floor and understand it is also to think this isn't just about groups, but kinds of vulnerabilities that households face, and the big ones that people face throughout their life course. Now up there it's actually described as groups of children, working age, elderly, but you could actually easily put it as kind of childhood, working age vulnerabilities, disability, unemployment, elderly, old age. And really I think the question should be less, you know, is that group covered by one grant or another, but what are the vulnerabilities people face throughout their lives? What are the big challenges people face? Disability, old age. Now, if one household is facing multiple vulnerabilities, if they're both having to care for children, many of the working age members are living with disability, and there's an older person in the house, well then there's a strong justification that actually they shouldn't just get one grant, but they should get a kind of overlapping provision of multiple kinds of support. On the other hand, if there's a household which is two working age members who are both fully employed, well then arguably they wouldn't need any kind of extra additional support at that point in their life at all. So I think that duplication, you know, multiple benefits, multiple schemes going to a household isn't necessarily a bad thing. I would probably argue as well the countries that have the most comprehensive, successful social protection floors, it's where often you have a sense of kind of overlapping different kinds of schemes which are focusing on different things, but that complement each other rather than, I see, duplicate them.
An older person also have disability and also living with HIV/AIDS. They will have 3 allowances, and that's, we think it's acceptable because they face different problems.
Tools. We need to make sure this costing tool actually provide the policymakers and allow them to actually make informed decisions about it. So it's good. That's what the first question they will ask. As she was saying, there will be some like also with multiple benefits, which is very good because the vulnerability is very high in some of those households. But in terms of technically, it's important that we know where the money is going and everything. And it's just a matter to translate this kind of needs for policymaker for analysis into your tools, which is very useful for policy making.
And in each of these programs, there are administrative costs. And it can happen, theoretically, I cannot prove it through statistics, that $1 of benefit may be costing on the administration side $1.50, which is not at all very good. If it takes you more money to deliver than the benefit that goes to the beneficiary. So how do you get that into the costing question so that you can avoid it? In other words, do we have to cost it to include the cohering of the program so that we can harmonize or at least unify the administrative part to reduce that portion of the posting, so we can give more to benefits to the people. But then, how do you also get in the idea of, say, graduating the beneficiaries to become responsible for their own lives?
Actually, in Cambodia and in Indonesia, we are embarked with the government on the design of a mechanism that we call the single window service, and which is one of the recommendations of these assessments, to do exactly what you are suggesting, which is first is to ensure that people have not only one program here, one program there, one program there, but that there is a comprehensive understanding of their vulnerabilities and their needs at household level, so that they can get a set of benefits which really answers their problems. So in this sense, we think that, for instance, by linking social protection types of interventions and vocational training or access to services that will increase the employability of the people will graduate more easily out of poverty. So we base our approach on similar approaches that have already been implemented in other countries, such as in Chile or other continents. So this is one thing about graduation. The other thing about efficiencies, we try to see whether instead of implementing each program separately, which is often the case because these programs are managed by different line ministries, in the framework of the extension of social security through the new BPJS 1, BPJS 2, that are supposed to cover as well the poor and the informal sector, they see the single window service as a mechanism to really reach out to these people. Because usually social security organization, they stop at the provincial level, but here we are talking about people who are at the district or the commune level.
So I still not clear how can we identify the assumption. Is there any specific method to identify at least some basic information that can help on the assumption?
There's a science to it. I consulted with actuaries in Geneva, for instance, when you say whether you want to increase the benefit of health care based on inflation or based on wage increase, for instance, then there are considerations that they presented, that in health, based on experiences, then you should take into account the wage increase, because the more people are making, the more utilization to health care is, things like that. So there are some science to it, but there are also parts where you just need to consult people and decide which one is more realistic. For instance, on the level of benefit. Of course, you would like to assume that the poverty line should be the amount where people can survive on. But of course, there's also other considerations. For instance, when you are disabled, then the poverty line may not be sufficient for you and so on. So there are some parts that requires discussion, some parts completely how you decide, and some parts quite strict. But we can discuss further on this outside of